The Steripath micro blood culture collection system reduces false positive blood cultures by diverting and sequestering the initial 0.5 to 1.0 milliliter of blood, preventing skin contaminants, when present, from entering blood culture bottles. The following video tutorial demonstrates proper use of Steripath Micro with integrated syringe for peripheral venipuncture. Collect the necessary supplies, including Steripath Micro with integrated syringe and either the 21 gauge or 23 gauge BD Vacutainer UltraTouch push-button blood collection set. Perform skin surface antisepsis according to your institution's established guidelines. While skin antisepsis is air drying, thoroughly disinfect each bottle top with an alcohol prep pad. Scrub for 15 seconds, let air dry, and leave a new pad on top of the bottle. Open Steripath Micro, keeping the device on sterile packaging to prevent contamination. Open blood transfer device, keeping the device on sterile packaging. Ensure site is completely dry. Perform venipuncture following standard procedure. Consider securing the site as needed. After achieving venous access, slowly and steadily draw syringe plunger to divert initial specimen of blood into the C-shaped diversion chamber. Monitor blood flow into diversion chamber until it is full. Fully depress the button on the side of the diversion device to lock in potential contaminants. Continue pulling back on syringe plunger to collect blood culture sample following standard procedure. After collecting blood culture sample, slide clamp to occlude tubing. Disconnect Steripath Micro with syringe attached. Place device on sterile packaging. Be sure not to push syringe plunger. If required, attach syringe to collect additional specimens for blood work. If additional specimens are not required, immediately dispose of supplies according to institution policy. Using aseptic technique, disconnect syringe from Steripath Micro. Immediately attach blood transfer device to avoid touchpoint contamination. Transfer blood from syringe to the bottle using bottle's vacuum. Do not depress plunger of syringe. Fill the culture bottle according to institution policy. Gently agitate bottle several times to prevent clotting. Follow the same procedure for inoculation of second bottle. Be sure not to introduce air into anaerobic bottle. Gently agitate bottle several times to prevent clotting. Lastly, dispose of supplies according to institution policy.